insurance system, which complements and supplements.
Wow, they have a voluntary private health insurance also in Australia. That's good. Hello everyone, and welcome back to my channel. Okay, today I'm going to react on a video of healthcare triage. Please do support by subscribing this channel also. And today we're going to see and to find out the Australian healthcare. This is one of the important things for a country, especially for the citizens. Okay, and before we start, I would like to thank everyone who already support my channel by subscribing it, and for those who still not, please do so because I really need it and I really appreciate it. Thank you guys. And without further ado, let's go everyone and watch with me. Are you ready everyone? Let's get started. Hospital.
It's been a while since we've done an international healthcare system episode. We thought you might need a break. That break ends now. Australia has the only continental universal healthcare system, and it's the topic of this week's healthcare triage.
Healthcare triage.
Like pretty much every other country we've covered, save the United States, Australia has a universal healthcare system. It's called
Universal.
Medicare. What is the deal with that? Seriously, do none of these countries have a thesaurus or something? Medicare. Anyway, Australia's national public system provides coverage for citizens, permanent residents, and even many people with temporary visas. There's a program for visiting students, and even people seeking asylum get coverage while their cases are under review. Australia also has a voluntary private health insurance system, which complements and supplements.
Wow, they have a voluntary private health insurance also in Australia. That's good.
The public one. It can give citizens access to private hospitals and some services not covered by the public system. The tax system incentivizes the purchase of private insurance for many individuals and families. Medicare also allows people to get free inpatient care in public hospitals, free access to most medical services, and prescription drugs. The federal government also works with more local governments to provide population health, mental health, some dental care, some physical therapy, and services for veterans.
I like it. This is the thing that we need, actually.
Medicare pays for somewhere between 85% and 100% of outpatient services. It also pays for 75% of the medical fees schedule for private patients who use public hospitals. Whatever isn't covered must be paid for by patients. Doctors can charge whatever they want, although incentives are in place to make bulk billing more likely for the elderly, poor people, children, and people who live in rural areas. Members of those groups also get a discount on drugs. Their co-pays on prescriptions are around $5.90 Australian versus $36.10 for everyone else. There are out-of-pocket maximums. When an Australian is paid out $421.70, then Medicare covers 100% of the fee scheduled for doctors for the rest of the year. When they reach $1,221.90, then 80% of all out-of-pocket costs are covered for the rest of the year. For people in the special groups I mentioned before, the threshold is lowered to $610.70. Yes, that's complicated. Thanks, Australia. There are also ways for families to pool such spending and to hit the limits faster. There are pharmaceutical subsidies for those who reach a threshold of $1,391 in a calendar year too for drugs. The threshold is also lower for those in the special groups at $354. Australia is one of the cheaper healthcare systems. At 8.9% of GDP, Medicare is paid for mostly from general taxes, patient fees, and a 1.5% levy on taxable income. In 2010 to 11, the government funded about 69% of spending. 43% at the federal level, and 26% from states and territories. The rest, or about 31% of healthcare spending, comes from non-government sources. About 18% is out-of-pocket spending, in co-pays or services not covered by insurance. Private health insurance accounted for about 8% of spending. About half of people have private insurance, which allows them more options in practitioners, hospitals, and care that they receive. Those who opt for private insurance before their 31st birthday get a reduction in premiums for the rest of their lives.
Wow. Reduction in premiums for the rest of their life if you reach 31.
Each year, an Australian waits to start buying private insurance after they're 30 sees their rates go up 2% from a base rate, again, for as long as they live. Subsidies have been available to many Australians based on income since 1999. Most primary care doctors are self-employed and work in groups. About 8% of them are under contract with private agencies. Most work in a fee-for-service system. Most also get incentive payments for meeting standards set by the Royal Australian College of General Practitioners. In other words, they have a pay-for-performance system to try to improve quality. I know you watched that video, right? Patients can see any general practitioner they like. GPs do, however, need to refer them to specialists. Specialists also work on a fee-for-service basis, and many of them work in both the public and private parts of the system. After-hours care is available either from primary care docs themselves or from private companies set up among various practices. Grants are available from the government to run after-hours care. Hospitals come in all flavors. In 2011, about 55% were public, 23% were private day hospitals, and 21% were other types of private hospitals. Private hospitals come both in non-profit and for-profit types. Docs that work in public hospitals are usually salaried, although they can work in other reimbursement settings when seeing private patients. Long-term care is mostly provided by families, with some people getting subsidies to help with the expenses. Some homes or care centers are available for those who are very dependent on assistance. Support is both means-tested and dependence-tested. The majority of long-term care facilities are non-profit. About a third are private, for-profit, and about 10% are run by the government. Quality is generally measured and reported on by the Australian Commission on Safety and Quality in Healthcare. About 85% of general practices are accredited against standards, and as I mentioned before, pay-for-performance systems are in place to encourage better care. Some healthcare organizations and professional boards also have quality improvement programs. All citizens and permanent residents can get a personally controlled electronic health record if they want it. A fairly large amount of infrastructure exists to make such records interoperable at many facilities across the continent. Costs are controlled in a number of ways. The market uses generic drugs to keep pharmaceutical spending down. Almost all brand name drugs are bulk purchased by the government, which can also control pricing.
This is good because the government is taking over that, and then they can control the pricing. That's good for market.
New drugs have to prove their cost effectiveness before they're bought. Public spending is under global
that's
budgets,
right.
but as with some other countries, this can lead to increased wait times for elective things. There are also broadly negotiated fees for many services. The knocks against the system will be familiar to those of you who are familiar with the series. Australia is worried about a shortage of professionals, but who isn't? In terms of quality, Australia sometimes comes behind some other countries we've discussed, but certainly beats others, like the US. The private
Like the US, Australia beats US recently.
overlay makes some people there concerned about a two-tiered system of care. It's interesting, though, that only about half of people opt for private insurance. Australia also has a disparities problem, with many indigenous populations having lower quality outcomes and poorer health than other citizens. But life expectancy is high, infant mortality is low, obesity is extremely low, and preventable deaths are rarer than a lot of other countries. And Australia does it for a reasonably small amount of money. In summary, Australia has a pretty robust public healthcare system with a private overlay that half of people use for better access and services. If that sounds familiar, it's because it's much like other systems we've talked about, including France.
Wow, I think that is the great information about the Australian healthcare, and the Australian must be so fortunate, and I'm also impressed with the Australian healthcare. I was very impressed that we can say Australia as a great country for the medical and pharmaceutical, and yeah, very proud to hear that. And it sounds like so shock also. I mean, it sounds like US, Australia is better than US healthcare, and they need to improve on that and learn from the best. And what I heard just now is just a completely a good care of, especially on healthcare, to the citizens of Australia. And Medicare is actually allows people to get free inpatient care in public hospitals, free access to most medical services, and prescription of drugs. That was so great for me. For the citizen, healthcare is one of the best thing, or something that we have to take care extra on it. And I think the government of Australia did a good service to, especially not for everyone, each one of Australian, and also a good service to the veteran as well. And this will make all the Australian very great, especially in health. And I think most of the country in the world have to learn and taking this kind of Australian healthcare as a model for them to follow, to ensure that everyone, especially every citizen is getting the best service, especially for the healthcare, because we know healthcare is one of the important things in our life to get peace of mind, especially in healthcare. And I hope that all the countries also in the world can make Australia as an example to follow, and to ensure that we can living in a peace of mind without thinking of the healthcare services and so on. And this video really helped me to getting to know more about Australian healthcare, and really helped me. And for those who still didn't know about the Australian healthcare also. And until then, everyone, as usual, if you like this video, don't forget to share it and liking it. And thank you for everyone to already support me by subscribing my channel. And for those still not who still not yet subscribing, please do so, because I really appreciate, I really need it, guys. Please do support. Till next, everyone, goodbye and take care, everyone.
You went away.